If you have irritation right in front of the shoulder and it hurts maybe going overhead or reaching across the body, in this video I'm going to show you what this is and steps that you could do to actually fix this. Irritation right to the front of the shoulder can be a variety of things. In this video, let's focus on biceps irritation. The biceps muscles is in front of your arm and they flex the elbow, and it also supinates the forearm. So it does this and it does this. So to stretch it, we have to straighten the elbow and also pronate the arm. Now, the attachment sites are crucial to understand here. They attach, there's two heads of the biceps, and they both go into the shoulder blade, onto the coracoid process of the shoulder blade, and also the glenoid tubercle of the shoulder up into here, into the shoulder blade. So when they come and they wrap right in front of the shoulder, it can cause irritation when it's here. And a lot of times we can just put our hand right on the irritated part and go in and out with the arm like this and feel something bumpy going over it. And that's usually the long head of the biceps muscle. And that can cause little irritation right there, which can kind of cue you into maybe irritation to that specific structure. Along with irritation to the front of the shoulder, just feeling it, we could also cue us into specifically targeting those tissues by putting the arm straight out like this with the palm up and try to push the arm down. If that causes some of that irritation to here, then it can kind of cue you more into that you're actually dealing with that particular issue. So to stretch the biceps effectively without aggressively doing this, we just have to set ourselves up in a position to do that. So we need to be into an extended position like so, and then the palm down to actually effectively stretch it. So from here, I'm gonna use my stall bars as an example and face my palm away from me with my shoulder going backwards. So from here, I'm just gonna step forward until I feel a nice stretch through all of this tissue here. Then I'm gonna hold it just for a stretch period. Say an example for 30 seconds. After 30 seconds goes down, I wanna provide some contract, relax components to it to build some input into those positions to go further and further into the position. So from here, I hold it for 30 seconds. After 30 seconds is done, I'm gonna think about pushing this way into what I'm holding. Hold that for 10 seconds. Then after that, I relax, and then I can sink further into the stretch by lowering myself down or stepping out further. So my arm went from here to then here. So we're doing this by adding the contract, relax components into this to teach the body how to control different ranges of motion, and also when muscles are irritated and they're on stretch, they don't feel great when they're irritated. So by putting some isometric load through it, we create this analgesic effect which lowers the discomfort. So we're gonna hold, you typically wanna do also 4 cycles of this. So a 30-second stretch, 10-second contraction, and then relax, and then another cycle, 4 rounds. So 30-second stretch, 10 seconds pushing down, relax, go deeper into the stretch, and then repeat it. The idea is not to aggressively go back, but just enough where you feel that stretch going on to the front area of the shoulder and the biceps. After the stretch and we get comfortable more on lengthening tissue, we want to put some eccentric load through this area in a controlled manner without aggressively doing this, so that we could build more strength and capacity to this. So when we're putting eccentric load through the biceps tissue, the bicep goes into the tendon, which is typically the irritated issue, but it all connects. So we want to put that directionality to that area. So from here, we want to choose a weight that's not aggressively heavy, but enough where we feel it working. Now from here, I'm going to go lower myself down, 3-second count, 5-second count, until I get to the end position until my arm is straight. Then from here, to really emphasize the eccentric part, I don't want to just curl up, so I'm going to take my other hand and assist it back up so that I'm actually lowering nice and slow, working in this area. Now when you're going down, you want to be mindful of not just dumping the shoulder forward, because that's just going to slack the tissue. Keep the shoulder back in a protracted position right here and go nice and slow down, feeling this. Now the last component to eccentrics is we can add a little bit of twist at the end to really start to lengthening it at the elbow part. So I assist back up, nice and slow down, and then twist at the end to really put a lot of eccentric load to this tissue. Key components is this one is don't just rush down on the eccentric and then don't dump the shoulder forward. Keep the shoulder blade back, go down nice and slowly. Once you get comfortable, you can twist at the end, then assist back up into the motion. And with this, 3 rounds, 12, 15 reps to this area to really get some load to this area. Now we also want to work on shoulder muscles around the scapula, not just the biceps localized. So the first two, yes, stretch and eccentrics, but we want to work on the rotator cuff too, because a lot of times when that gets weak or not stable enough, it can lead to a lot of stress and strain, which the biceps come and overwork as a compensation. So working on the shoulder muscles is key. So from here, I'm gonna have a band attached to me that wants to go this way, and I'm gonna have my arm in this position where I'm gonna go out into external rotation at the shoulder, which biases the rotator cuff, external rotators, which typically get blamed for a lot of stuff. So I go into external rotation, I hold that, maintain my forearm maintain my forearm perpendicular to the floor as I punch up, and I come back down, and I go back. What we're doing here is working the cuff in a dynamic fashion to really strengthen the shoulder and the shoulder blade, moving dynamically through this to really isolate those targeted tissue to help offload the biceps as a compensatory factor here to help out if these areas are weak or not as stable enough. So I go here and punch up. Now with this, you wanna make sure when you're punching up, your elbow's not flaring out to the side. You're not just going fast. And you're not using something that's so heavy. To bias the cuff, you don't need a lot of weight. It's not about, when you do more and more weight, other areas like the deltoid muscle kick on to help onto that. You don't need a lot of force to really bias the cuff area to activate. So this is a light band, this is 12 pounds, and if I do a couple reps here, I already feel my shoulder burning when I do this. So up and down. With this, I like reps, 3 sets, 12, 15, because it's not a huge weight, but you want to feel a nice burn to that area to really strengthen and stabilize the areas around the shoulder to, again, hopefully offload the biceps area in this case. So to recap, we went over 3 main exercises, and it's not about doing all 1,000 different things. It's about just staying localized to a couple things. You see what that does for you, and then you can build off of these. We did a stretch, we did an eccentric part, which really biases the biceps specifically, and then we worked around the area of the biceps to help offload a little bit. So hopefully it gave you some insight and value to really understand these things and attack it maybe in a little bit of a different way than you have been. If you did find value in this video, I'd greatly appreciate it if you subscribe to the channel down below, like this video, leave any comments down below, and your support is greatly appreciated. So I really do hope you did find value in this, and this is Dr. Nick. I'll see you on the next one.